Hi guys, welcome to another episode of Life with Juan. It's me, Juan, and I've been studying for the Philippine board exams for medicine, also called the Physician Licensure Examination, also called the PLE, which stands for, well, you guessed it, the Physician's Licensure Examination. I figured I needed to take a quick break from studying, and in order to relieve some stress, I decided to make this video. Now I'm studying surgery, which was one of the more meticulous subjects covered in the examination. There are so many surgical techniques, eponyms, and grading scales that you have to remember. In particular, one of the more technical concepts that you have to remember in the surgery topic is the staging criteria for breast cancer. Breast cancer is the most common type of cancer in females, and it's the third most common cause of death secondary to cancer in females. Its presentation varies greatly from tiny bumps in the breast to ulcerating defacement of the breast tissue and even metastasis to other parts of the body, like the bones, the lungs, and the liver. Not so fun fact, breast cancer can also present in males. Male breast cancer presents in less than 1% of all breast cancers, but it has a similar chance of survival to that of females. Although usually males who have breast cancer do much worse than females because these are detected at a much later stage. Anyway, I said that breast cancer is one of the more technical aspects of surgery because of the way that breast cancers are staged. There are 5 stages of breast cancer, not including the IS staging and the sub-stages with the A's and the B's and the C's. Oh my! Breast cancer staging, like staging of most other cancers, is based on 3 criteria: tumor growth, nodular spread, and distant metastases, or simply put, T, N, and M. The degrees of growth, spread, and mets determine how high the stage of breast cancer is. Apologies in advance, I'm going to be doing a lot of talking because sadly I'm not allowed to share my reference material in this video. However, sure to rest that this stuff, what I'm talking about, is consistent with what most other med students are studying to do good in their board exams. Time for tea! Let's start with the growth of the tumor. This is divided into 6 levels: TIS, TO, T1, T2, T3, and T4. The IS in TIS means in situ. In situ? In situ? In situ. Like the T. Or, the tumor's growth is blocked by the basement membrane. Now, TO means there's no evidence of a tumor. T1 means the tumor is at most 2 centimeters in size. T2 means the tumor is between 2 and 5 centimeters in size. T3 means the tumor is greater than 5 centimeters. And T4 means the tumor can be any size, but is pressing hard against the skin or the chest wall. Woo! No regard for social distancing. Next is N, or lymph node spread. Who am I kidding? I'm not really a tea person. I'm a coffee person. First is NO, means there's no evidence of nodes present. Next, N1, which means that the tumor has grown to an armpit lymph node on the same side as your tumor, and you can roll it around like a marble under your skin. Crawling in my skin! N2 means that it's moved to an armpit lymph node, but it's stuck. It's matted, or you can't move it around. And also, it's spread to an internal mammary lymph node 2. Get it? 2, because N2. Then, N3 means it's moved to a lymph node above or below the clavicles. Finally, M. Pretty straightforward. MO means there are no distant metastases, while M1 means there are. That means somewhere really far, like on the other side of the chest or beyond any of the areas covered in N. Now, let's review. There are three characteristics: T, N, and M. In order to stage this, you need to take a look at this really highfalutin table and cross-reference to see what stage the tumor is in. It can be anywhere from O to 4, or to be more specific, it can be in stage O, stage 1, stage 2A, stage 2B, stage 3A, stage 3B, stage 3C, and stage 4. Whew! Now, I'm not gonna stress over this table because it's really complicated, don't it? However, based on this table and using simple mathematics, I have derived my own, I believe, more simplified way to stage these tumors. I call it the Juan algorithm, or the Hualgorithm. Okay, I'm not a board-certified doctor just yet, and I didn't really reference any complicated journals, so I don't think I'm allowed to do that. At least I don't think I am. But if ever I am allowed to, well, you know I called it. Also, I think I'm supposed to use my last name, so I guess you would call this the LifeWith algorithm, or I don't know, the LifeWithgorithm, or the LifeWith'em. Anyway, I can fix the technicalities later. Here's how I did it. First, I assigned a special color to each number. Flash means 0, yellow means 1, green means 2, blue means 3, and purple means 4. I don't think that really did anything, I just thought it makes it look pretty. Then, after looking at the colors, I realized that there are certain patterns which are fulfilled by each stage. For example, stage 4 is the only one where M has a value of 1. Likewise, stage 3 is the only one where N has a value of 2. Huh? See where I'm going? And so, using that data, I came up with this here flowchart over here. We start with M. If it has a value of 1, then automatically, no questions asked, you're at stage 4. I'm not gonna do the wrapping. No, it doesn't work for me. It's a no from me. We start with M. If M has a value of 1, then automatically, with no questions asked, you are at stage 4. However, if M is equal to 0, you go to N. If N is equal to 3, you're automatically stage 3C. If not, then you go to T. If T is equal to 4, you're at stage 3B. Then, if not, you go back to N. If N is equal to 2, you're at stage 3A. Finally, if N is not equal to 2, then you're only left with two other possibilities, 0 or 1. Then, the rest of it depends on your T. If N is a 0 and your T is a 3, you're at stage 2B. If your T is a 2, you're at stage 2A. If your T is a 1, stage 1. And if T is an IS, you're at stage 0. However, if your N is a 1 and your T is a 3, you're at 3A. If your T is a 2, 2B. And if not, and your T is either a 0 or 1, you're 2A. Oh, yeah, there you have it. Now there's like an updated breast cancer staging based on whether or not your tumor expresses the special genes ER, PER, and HER2. But like, I don't want to delve into that. We can just simply conclude that the staging is worse if these genes are not expressed by your tumor. Sha. Now, if you're not into flowcharts and tables are more your thing, I made a table for you too. Yeah! However, I won't explain it for you though. The logic is pretty similar to the logic of my flowchart. You can probably figure it out. Well, that about does it. That's how to stage breast cancer using a flowchart. What did you think of this video? Did you like it? Did you not like it? Did you not like it? Or did you not like it? If you did like it, please give me a thumbs up, leave a comment, and subscribe to my channel. And click the bell icon too. That's it for today's video. Remember to stay at home and stay healthy. Eat healthy food, sleep early, and take care of yourselves. And remember, live life to the fullest because you only have one life to live. Bye. Na 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 na. And is the third. Wait. Now, before I continue, apologies in advance. I'm going to be doing a lot of topic in this video. Who am I kidding? I'm not really a tea person. I'm a coffee person. Who am I kidding? I'm not really a tea person. Anyway, now there's like an updating. However, based on this table and using simple mathematics, I have divided. Now that I'm done with that video, I'm gonna go back to studying for my boards. I'm a man of my word.